Thanks for watching WCCO, now streaming on CBSN Minnesota. Frank is off this evening. We learned today that Minnesota is one of 22 states that has sent samples to the CDC for testing of the coronavirus. The deadly new virus that emerged late last month has killed 25 and sickened more than 800 people in China. Just today, we learned a second case has been confirmed here in the United States in Chicago. To be clear, Minnesota does not have any confirmed cases, but state health officials talked today about how and why they are keeping a close watch. Here's Heather Brown.
This is considered to be a low-risk situation for the general public, and just to enlist everyone's help in kind of a heightened state of vigilance.
The coronavirus is new, which is partly why the state's infectious disease experts are sharing what they know.
Someone develops fever and respiratory illness.
And what they don't.
We do not yet have robust data on the severity of the virus. Although many infections are thought to be mild, there have been severe infections.
Earlier this week, the Department of Health sent out an alert to hospitals and local health departments. They were asking to be told if someone shows up with flu or cold symptoms and had traveled to Wuhan, China within the past 2 weeks. So far, 2 people in Minnesota met that criteria. The state has sent specimens from them to the CDC for testing.
These individuals have not been ill enough to require hospitalization.
Across the country, the CDC says 63 people are under review for coronavirus. 13 have completed testing, and only 2 have come back positive, the ones in Seattle and Chicago.
We do not know how easily or sustainably the virus is spread between people.
But experts believe it doesn't linger in the air like measles, but rather spreads like the flu. That said, unless you've recently been to Wuhan, their message today: be aware, but don't worry.
The likelihood that your symptoms have anything to do with this novel coronavirus are exceptionally low, and you should be thinking about influenza and the common cold.
Heather Brown, WCCO 4 News.
Since the symptoms of coronavirus are so similar to cold or flus, it is hard to distinguish without testing. So the same prevention measures apply. Cover when you cough, stay home when you're sick, and wash your hands. Today's news conference cleared up a lot of questions about coronavirus, and we have been streaming it through the day on CBSN Minnesota. We've also made it easy to find on our website, WCCO.com.